Good night, Cayman Islands. You're watching the CMR COVID Spotlight. And of course, we want to just kind of bring you a little global perspective of what's going on with COVID throughout the world as people are starting to join. We'll be sending out some messages so people could, remind them that they're going to be, that we have the show live right now, and we're going to be encouraging people to join. So if you're watching this right now, be sure to also share it on your social media so others would be able to start watching. But before we get started with tonight's show, and the topic for tonight is going to be the frontline healthcare workers who will be highlighting their experience. And so let's take a look globally. The numbers of weekly COVID-19 cases and deaths continued to decline. Over 3.3 million new cases and over 55,000 new deaths were reported between September the 20th to 26th. And that is a decrease, actually, because, we had a Delta variant recently really causing some trouble throughout the world. And so that's a decrease of about 10% compared to the previous week in both cases and deaths. The largest decrease in the weekly cases was reported from the Eastern Mediterranean region, followed by the Western Pacific region, and then the Americas, which is North America, South and Central America, then the African region, then followed by the Southeast Asian region. And then while weekly cases in the European region were similar to the previous week, that's kind of what they had going on there. It's pretty much the same. The number of confirmed cases reported globally is now over 231 million people, and the number of people who've passed away, unfortunately, from COVID throughout the world is 4.7 million. And as of yesterday, September 27th, there have been about 6 billion, just under that number, 6 billion vaccines administered throughout the world. And then as we take a look at the Cayman Islands, if you follow Cayman Mall Road news alerts, you would have probably seen by now that a Prospect Primary Year 6 student tested positive for COVID today. And so Prospect Primary will be closed tomorrow, which is Wednesday, so they can do a deep cleaning of the school. And they do plan, according to the latest information that was released, they do plan to reopen on Thursday. And parents who have students that attend Prospect Primary should monitor their emails for further information. And of course, CMR will be on top of it and will be updating the story once more information is confirmed. But looking at yesterday's numbers, it looks like 12 new positive tests in travelers and 5 in members of the community were reported. And 3 of those cases were community members who are in isolation at home with some previously known to be positive as a result of the first recent community outbreak. They have been on the GPS tracking program for the last couple of weeks. So the other 2 cases were in members of the public who were in isolation as a result of the Georgetown Primary School outbreak, and we know that will increase now that we have the development at Prospect Primary with at least 1 child testing positive, and we're going to definitely keep our eyes out to see how that might be developing. And then for testing, there have been 106,157 COVID vaccines given, for vaccines. There have been 106,157 COVID vaccinations given in total in the Cayman Islands. So that now puts us at 77% of the entire population that's gotten at least 1 dose of the COVID vaccine, or about 72% that's actually completed both courses. And about as of yesterday, 31 people received their booster dose. And so we're going to be, again, bringing on some frontline healthcare workers very soon. But right before we do that, I do have a video that we want to share with you that was produced by the University of Florida, or UF Health nurses. And so we're going to go ahead and play that video so you could have a look at what some nurses who are not on the show are saying about what's going on in their hospital.
So we've been doing COVID since February of last year. By far, now is much worse than I've ever seen it. Patients are much younger. Patients with no past medical history whatsoever are coming in.
With this wave, the patients, they decline quickly. We've had patients come in and they were on no oxygen, and the next day you come in and they were requiring 6 liters of oxygen and then having to go to high flow.
I think a lot of patients, once they started to see the numbers go down, they started to feel that everything was going back to normal. So of course they were going around without masks, and they were excited to see their families. And unfortunately, those who are unvaccinated came in and they became ill.
One of my patients, he came in, he was unvaccinated, and he wasn't requiring any oxygen. That next morning, he was having trouble breathing, he was coughing, really struggling to catch a breath, and we eventually had to upgrade him to a higher level unit of care, and he stated that he wished he had got the vaccine.
It's frustrating because, now we have a vaccine, and it's with the research and everything, you can see that it does work. I understand, I didn't run out and get the vaccine very first week or anything. I did my research, and I felt like it was the best thing to do for me, my family, my coworkers, my patients.
I would encourage patients and their family members to get vaccinated. We don't have that many beds in the hospital, so please do your part to keep everyone around you safe.
If you're eligible for the vaccine, get the vaccine.
Please go get vaccinated for you and your loved ones. A lot of this could be prevented. Hopefully, eventually, one day we go back to normal.
So you just heard from some healthcare workers from UF Health, and we're now going to introduce our guests. But right before I do, I want to make sure that if you're watching, please, please, please share it to your social media. Let people know that we are on, because if you have questions for the folks that we are bringing on, want to make sure that you could get them answered live. Of course, if you watch this after we air it, we won't be able to have that interaction, but at the same time, you'll still be able to benefit from the information that will be shared. But we do have Danielle Jones. She is a clinical dietitian. She ensures people that are hospitalized with COVID are getting healthy meals, and we're going to talk to her in just a bit. We also have Jen Bodden Evans, who is a paramedic. And she's someone that, when you call 911, she shows up and she performs advanced medical care as the person is getting ready to be transferred to the hospital. And she actually has a strong Cayman connection. She's Caymanian as well, but she lives here in Florida. And then we also have Cosette Hubbard. She prepares paramedics for when they are getting ready to go out in the world. She teaches at Bartow Academy, I believe, as well as she also is someone that caught COVID as well, and she's going to be sharing some of her stories. And then we also have Aisha Stanford. She is a registered nurse, and when COVID was just beginning, they needed people to travel to the areas that were having a lot of trouble with shortages and nursing staffs, and she was all over the United States. She worked in the ICU in California, North Carolina, Massachusetts, Florida. We'll definitely hear from her as well. Thank you all for joining us tonight. So,
thanks for having us.
Danielle, I'm going to start off with you. Tell us a little bit more about, we heard that you are a clinical dietitian. Tell me a little bit about what you do in that role.
In my role in the hospital, it's funny you said I help with the meals, but definitely I think the first thought that people always think about is what we eat. And especially with COVID, a lot of taste is affected, a lot of smells affected, and people really have poor appetite. So sometimes I feel like I'm being a food cheerleader where it's just encouraging them on. And other times when they're intubated and on a vent, it's a matter of doing the tube feed calculations to try to make sure that they're getting adequate nutrition to really optimize their health as much as possible.
Thank you. And Jen, let's talk about your role. Same question.
Basically, you call 911 and I come to your house and I help you with whatever medical emergency that you're having. So.
And then we'll go to Cosette.
Hi, I'm a paramedic firefighter, retired, and now I'm in the teaching realm. We have a medical and fire academy, and I'm teaching the students to go in. A lot of our students are doing clinicals now that clinicals have reopened. And I was lucky enough to get the vaccine, get COVID, and get the antibody treatment. So I should be cured of everything now.
Sure enough. And Asia, let's talk about what you do as well.
I am a certified critical care nurse. Unfortunately, by the time a patient gets to me, they're in the worst shape possible as it relates to COVID. Usually, by the time I see the patients, they are intubated, or we're in the process of intubating them, which means putting in a breathing tube and placing them on the ventilator. We do the absolute highest level of care, whether that be full respiratory, blood pressure support, dialysis of different versions. It can be quite intense by the time you get to the ICU as a COVID patient. But we are there to support the families and patients as much as possible. Right now, it's a grim time. It's grim, but we're all pushing along as healthcare providers and doing the best we can during these times.
Thank you. Yeah. So, what's it been like for on the job? I know COVID's been pretty stressful for a lot of healthcare workers. What's it been like for you?
It is a stressful time, but one thing I want to highlight first is the dynamic teamwork that I've seen exhibited amongst everyone who works, not only in the inpatient setting, but the outpatient setting. It takes a full tribe of healthcare providers to care for patients in the midst of a pandemic. But it has been trying, it has been difficult in the midst of staffing shortages, as well as supply shortages, even oxygen and ventilator shortages. You'll be surprised how we really have to ration a lot of the things and equipment that we have here. Sometimes it is determining who is the sickest and who's going to get these interventions and who's going to get this equipment. It has been that bad as of recent.
And because that you're one of those that is, you kind of, you're no longer in the fire rescue as much, but you're teaching those students and preparing them for the world. What's that been like, especially when clinicals and trying to social distance in the classroom setting? What's that been like for you?
It actually, when it first began, we were called in on March 13th, told everything was good to go. We'll see you on Monday. And 30 minutes later, we were all shut down. I already knew that our clinicals were probably about to get shut down, so I'd already stopped my students from doing that. And we went a whole year and a half, actually, without any type of clinicals. So thank goodness we had an executive order signed by the governor that gave us permission to double up on our lab time and count our clinicals as lab time. Otherwise, we wouldn't have been able to get our students through and try to get them the experience. Some other issues that we had was trying to build scenarios to include COVID, because when my students leave me, they're going on the ambulance, they're going in the hospital, and they're going in the doctor's offices. So trying to start getting them in the habit of putting your PPE on, because the days of us running calls and just wearing gloves and glasses is over. We wear full PPE now. We're wearing the goggles, we're wearing the mask, we're wearing the gloves, we're cleaning ourselves. In some instances, we're wearing the gowns and everything, and trying to get them ready for that was a little bit of a learning curve for us, especially when we didn't have anything. Yeah. Because quite honestly, our superintendent called all of the medical academies and said, hey, we're shut down. If you've got spare stuff, send it. And we actually gave the hospitals and fire and EMS a lot of our PPE supplies when it initially happened. So trying to get recovered from that has been quite a challenge.
Yeah. One of the good things, at least now, is they're doing better with a lot of those things. They have a lot more PPE. That's your mask and other protective gear that the healthcare workers will have to keep on to protect everyone, themselves as well as you. And so, it wasn't always like that. There was, again, in the beginning days, absolutely no PPE. And Jen, what's that like for you as, you're running 911 calls and people are not able to breathe, especially? That's one of the big presentations with COVID. or they're having some type of cardiac events. What's that like, not necessarily having a whole lot of gear to be able to go protect the people that you're there to save their lives?
Well, like, because I was saying in the beginning, it was difficult because we didn't have as much PPE as what we have now. We really had to sort of ration our PPE in order to use it for COVID patients. Now we have a lot of PPE, and we gown up fully. We have like what it makes me look like a yellow banana. It's just like a yellow Tyvek suit. I have that on. I have goggles, and I have my mask, and I have gloves on. So it has been a big change as far as going to regular 911 calls, but they're not regular anymore because of COVID. So you really have to be more cognizant of that.
And Danielle, I know you got a young little one at home, and PPE shortages initially, going to work. What was that like for your role?
Luckily, in my role, I don't enter the COVID room, so that I definitely take my hat off to everyone. But in the beginning, it was quite rough. That even my regular isolation patients that I would normally go see, there was no PPE to go see them. But
even entering the hospital setting, I mean, yeah.
Oh yeah, from the start, it was mask. Even to this day, mask throughout, mask all day. Literally only taking off your mask to eat. So it is nice that there is ample supply for PPE for everyone, but it's a whole different world from when it first started.
And one of the questions I got for you, Asia, I mean, you're seeing those most critically ill patients, and there's a lot of people who are out there, obviously throughout the USA, and in Cayman, even though they have a good you heard the vaccination percentage. We have a much better percentage of people who are fully vaccinated, but there's still a ways to go. It's not where it needs to be. But tell me about the type of patients that you have in your ICU. Are they typically vaccinated or unvaccinated?
Currently in our ICUs, and just to kind of give you a perspective, I work in a large hospital in Tampa, Florida. We currently have, and I'm literally in my office across from 3 of the ICUs. Just in the ones across the hall, we have about 70 beds just on this side of the hospital alone. Out of those 70 beds right now, about 40 of those are COVID patients. If I think about the hospital as a whole on this side, it's about 40 patients. A large majority of them are unvaccinated. For the ones that tend to be vaccinated, the issues we see with them getting admitted to the ICU are more so those with other comorbidities like immunocompromised people who are on chemotherapy, those who are on like biologic medications for rheumatoid arthritis or lupus and things like that. But the large majority are patients of every age that you can think of. Unfortunately, just yesterday we had a 35-year-old pass away. I came in today and I was informed that we had 9 deaths today, and the evening isn't over, and that's just in the ICU. So unfortunately, this does take, especially with the Delta variant, it takes a large toll on those who in the past we didn't think would be affected as severely, but this Delta variant is slightly different. And to touch on that, I mean, a lot of people don't understand why this is different than anything else, but with any other microbe or bug or offending microbe, they mutate. So these viruses, they become better at replication. They become more efficient in protein binding. So as they evolve, it becomes easier for a person to become infected. The microbe can stay around in your body a little longer. It makes you sicker. And the Delta variant has done just that, and it has proven to be even more deadly than we could have expected when COVID first hit, which is why vaccination is so very important. So very important. It's the single most important thing we can do at this point to get this under control.
Yep, and I know Sandra, I think, is monitoring our social media feeds on YouTube and Facebook where we're streaming, and I believe we had a question in there. Sandra, you want to go ahead and ask that one?
Oh. Hi, Kevin. Good evening. We have Rachel who's asking. She said, good evening and thanks for this. My question is, how many specialist healthcare workers does an intubated patient require? I heard 8 trained staff for 3 ventilated patients in 24 hours. Is that correct?
So It's a loaded question. So on average, one intubated patient has one nurse, and then we have support staff. So on patient ratio is different based on where you are. In Florida, on average, we have one nurse to every two patients. So I could be that one nurse and I could take care of two intubated patients, and we have support staff. So we have what's called like a certified nursing assistant or a patient care tech or someone else who assists us with some of those daily activities like bathing and things like that. But and then of course we have the physicians here in the ICU. So it doesn't necessarily take a whole tribe of people to care for that one patient, but it does take a lot of effort and time and close monitoring and eyes, so which is why we only have a limited number of patients per nurse.
Any other follow-ups on that, Sandra? And while she's looking, Jen, got a question for you about when you are having those initial conversations with patients that are getting picked up by you and your team. Have you ever heard of anyone who just got vaccinated and they automatically have some sort of adverse reaction?
No, I haven't had any patients that called to say that they've been vaccinated and then that's the reason why they're calling is because they're having adverse effects from it. I personally have not had anything like that. Generally, it's the opposite. It's that they have COVID and they're not vaccinated and they're really sick. So.
And I see Asia shaking her head because, I mean, she's the one that's going to be ultimately receiving some of your patients. And so what's your thoughts on that?
I would have to agree. I mean, sometimes they come in, and when they come into the ED, the emergency department. The emergency department gets a synopsis of the patient's condition prior to arrival. The paramedics and firefighters could be going to the scene and saying, "Hey, patients requiring oxygen. This is what they look like. We're going to bring them in." But they could get a call 10 minutes en route and say, "Hey, patients respiratory wise, they're tanking. We're going to intubate them now." So they're going to come in on a ventilator. It happens just that fast. You could be on the scene and the patient is somewhat respiratorily compromised, and while you're en route, they need full respiratory support, including the breathing tube and the ventilator. So sometimes by the time they get through those doors in the ED, we're now dealing with a completely different scenario, a completely different patient picture than we did when we EMS initially arrived on scene. So unfortunately, that is kind of how it can go with COVID and why vaccination again is so important.
And Cosette, I mean, you're training these future healthcare workers, these folks that are, getting ready to enter that world. Have you kind of seen an increase in people with that type of, with that interest?
You cut out a little bit. I couldn't really understand the question.
Sure. No, I was saying, with have you seen an increase in interest for people trying to enter school to be trained to become a paramedic or a healthcare worker under your program?
It's almost kind of twofold. Yes, there is. The ones that are getting into it are definitely there because that's what I want to do. And then we have some that are going, nope, not for me. I'm going to go business route. I'm going to go underwater basket weaving, whatever. But I don't want to be near sick people where I could die. And trying to convince them, okay, yes, the COVID is bad. Hands down, it's bad. But we have a vaccine. Now, granted, vaccine's not 100%. You're still getting COVID. Look at me. I got COVID. But you know what? I had a cold. I took my antibodies. I slept for 2 days. That's my experience with it. 6 friends of mine have died, but they were also unvaccinated. And I try not to, because in teaching we can't bring in our political or personal feelings, but trying to use it as a teaching point to go, we've had vaccines for years. That's why we don't have smallpox and that's why we don't have polio. Exactly. Use a little bit of common sense. Dr. Wayne Shepke, the state EMS director, very early on said, we need to get vaccines into emergency personnel and hospital personnel, because if we lose them, we've lost all of it, all of this. And the antibody treatments, very early on, he said, we've got to get antibody treatments into people very early on. I've talked to several ER physicians that I know personally who are like, at first blush, they were like, I don't know if I want to do that. But once you looked at the data and looked at the research and the science behind it, the vaccine is no different than any other vaccine that we're taking normally now. Yes, it was developed very quickly, and that's a teaching point for my students. Yes, it was developed very quickly, but it's no different than every vaccine that's out there. It's designed to treat COVID. It's no different than smallpox. It's no different than polio. It's no different than anything that we have. Is COVID here to stay? Darn sure is. We're not going to get rid of it. It's going to mutate. It's going to keep doing what it does. But we have the ability to protect ourselves. And I think that's the education piece that we try to bring into the patients and the students is, you have something at your fingertips to help you. Why not help you?
Yeah.
I
And
wonder if I
you
could
touched
ask
on something that is so real. The Cayman Islands, and you know, the only one that has a Cayman connection on the show right now who's on the guest is going to be Jen Bodden. But, you know, Cayman is not really used to seeing a lot of deaths in COVID. There are 2 deaths, just for your information, linked in Cayman, and they were not really community spread linked deaths. But you said something. You've had a number of people that you've known that passed away who are unvaccinated from COVID. I think just about most people, at least in America now, probably know someone that's had something that is a complete life-changing event for someone you love, or know at least someone that's passed away. I know several people that also passed away from COVID. Jen, I'm sure I'm sure you know people as well.
Yeah, I know of a nurse that I knew that worked at one of the local hospitals that passed away from COVID. That's pretty much the only one. All of my friends have been vaccinated, so fortunately, knock on wood, they're okay. So,
Danielle, anyone you know kind of somewhat in your circle unvaccinated or vaccinated that passed away?
Luckily, I've been fortunate to not know anyone who's passed away. No one who got it luckily survived, but thankfully not passed.
And Asia, what about you?
Unfortunately, in my community, there are countless people who passed away, whether in multiple families. I mean, there would be a family who had multiple people who passed as it relates to COVID. For many reasons, there is a distrust of the vaccine. There is also just uncertainty for those who just don't know, who just don't understand. And as a good point that was mentioned, is some people say, well, it was developed too quickly, and I combat that always by saying, but at the time that this created, we had all of the greatest minds in science and medicine all committed to one thing, and that was coming up with a solution to this pandemic. And so when you have the greatest minds all working together for one common goal, you're going to come out with something that's going to be, it did come out quickly. However, it was vetted. It went through multiple clinical trials with tens and hundreds of thousands of people. So we can't discredit the fact that, yes, it may have seemed like it happened in the blink of an eye, but literally it didn't. It didn't. When I was working in Massachusetts, I was a part of the remdesivir trial. It was an awesome experience, but like I said, it had the greatest minds in science that were all moving full steam ahead at coming towards a solution. But unfortunately, there is that medical mistrust that exists. And kind of also that was mentioned, I think that there are some political ties that kind of led to where we are, and that kind of has led to where people are not trusting the process, not trusting the science or the data, which is unfortunate. But as healthcare providers in whatever area we work in, I think it's very important that we help people understand the data. We understand it, but a layperson doesn't. So we have to explain to them how the vaccine works. How does it prevent those severe COVID symptoms, and how it works is to benefit our community as a whole. It's our responsibility as healthcare providers to educate our community and kind of help give them the comfort that they need sometimes to make the decision to get vaccinated.
And I got a question on that. Some people might not be used to remdesivir, so explain what remdesivir is. And Cosette, right after her, would you mind sharing, because you said that you got antibody treatment. I know it's kind of related, so go ahead and just kind of jump right on in. So go ahead, Asia.
Yeah, so remdesivir is an antiviral medication that we initially early on trialed to see if it would reduce the duplication of the COVID virus in a patient's immune system. It was kind of like a hit or miss because as people know, you heard a lot of medications flowing around at the time. Remdesivir stuck. It's one of those medications that we saw early on, the data supported that it really, really reduced the viral load of COVID in patients. So people were getting better quicker. They weren't advancing into those more severe states of ARDS or acute respiratory distress syndrome. So once we saw the data supporting remdesivir, it quickly became a mainstay in COVID treatment in patients.
And Cosette, you got some experience with antibody treatment?
Yeah, my wife first got COVID, and a few days later, I was asymptomatic, but at her prompting, she said, "Hey, I just don't feel comfortable. I think you need to get tested." I went and got tested. I tested positive. As soon as we found out both of us were positive, we said, "Okay, let's go get the antibodies." I'd already talked to Dr. Shepke prior to that and gotten a lot of information about the antibody monoclonal antibody treatment. And as soon as we found our location, we went and got it. 2 shots each arm, in the back of each arm. No big deal. Probably we got it in the morning. Probably by that afternoon, my biggest complaint was I felt tired. So basically I slept for 2 days, had a little bit of a cold, headache, achy, but that was about it. So, I thank Dr. Shepke for all of his information that he has tried to put out there to the EMS community and the fire community and public safety community to convince all of us we need to take care of ourselves. But to be honest with you, it was a cold for me, and I slept for 2 days, which, as busy as I am, that was a good thing.
Can I just ask a few questions? In Asia, just as a point of clarification, we try to really educate because we've got a lot of misinformation circulating in the local community here, and there are people who are getting on platforms that unfortunately they're having a wide reach. When they talk about the mRNA technology in particular being new, when I did my research, I discovered that this technology is based on, it's been in the works for some 50 years, actually. It's not new at all. And for the past 10 years, it has been used in a cancer vaccine. And there've been trials, ongoing trials in relation to that. So, so much of what is put out there has been debunked. But I want to specifically talk about, as a frontline worker in your particular case, I want to talk about this whole concept that people who are being vaccinated are having these side effects, because we've had people in the community here, although it's still a relatively small number, they're perpetrating this information, that there's so many people in this jurisdiction and elsewhere who have had horrific side effects from the vaccine. And they say that in this country, it's being covered up, it's being hidden. And I think people know that in this day and age, it's pretty hard to cover up or to hide anything. It is. So how many patients would you say that you have seen, just a rough estimate, that are COVID positive or that are, dealing with this virus? If you had to guess.
Oh, if we're talking since COVID,
let's just go back to January. So let's just think about the last 9 months of this year. Because the point that I'm trying to, the eventual question really is going to be, as it relates to, I want to know how many patients first, because then my point is, if you've seen, say, 5,000 patients, 10,000 patients, whatever, and you've not seen a single person with an adverse effect, which you said earlier, from the vaccine, how does a population the size of the Cayman Islands, where we have 71% vaccinated out of 70,000 people, right? You do the math, that's not really a whole lot in terms of population size. How do people here have all these side effects when maybe where you're at, nobody's having these side effects? How do you justify or understand what that could be?
So I want to start by saying this. So first I've seen countless. I mean, I can't even begin to um, estimate how many patients just this hospital alone I have cared for, let alone the patients that I cared for in Massachusetts, North Carolina, Miami, California. It's countless. What I will say, what in my experience with this, people get the vaccine, and unfortunately, they will say normal expected findings or experiences after the vaccine are side effects. So,
Mhm.
oh, I have a fever. Oh, I feel very lethargic. I'm having gastric symptoms. I just don't feel like myself. I'm down for 3 days. Those are normal immune
Mhm.
responses. Those are
Right.
not side effects of the vaccine. These are normal immune responses. And you don't want to blunt these effects because these what people are calling symptoms, these are immune responses that we want to see.
Right.
Because that is your immune system kicking in. It's your immune system recognizing that mRNA that we talked about, the messenger RNA that's in the vaccine, it's revving up so that the next time your body comes in contact with that virus, it can identify and say, "Oh, I know what this is. I know what this virus is. So let me kick in my immune response to protect
Mhm.
my body from COVID, the severe
Mhm.
symptoms of COVID." Now, with that said,
Mhm.
also, I can't tell you a single person outside of, and let me preface this. So, the COVID vaccine, it can cause what's called an inflammatory response. So, if you do
Right.
have lupus or some cardiomyopathy or some things like that, you may have some effects. The
Yes.
average person, you, I, or anyone else with no severe comorbidities are not going to have these wild side effects that I'm hearing. And some of them, unfortunately, for us who work in healthcare or even just use unfortunately, a bit of common sense, it seems outlandish and wild. But people
Mhm.
are buying into some of these things that I've heard as crazy as scrotal edema and heart attacks and strokes and all these things. It's almost mind boggling the amount of
Mhm.
misinformation that is out there. But when I say I have not come in contact with a single person in the hospital who is hospitalized because of the effects of the vaccine, it hasn't happened in my experience. So I think we have to be very cautious, what we listen to. We have to think
Mhm.
critically about these things. We have to say, okay, does this seem within the line of reason? First and foremost,
Mhm.
don't even concern yourself with data. Let's just say first, does this make sense? But then after that, we do have to look at the data. We have to look at the numbers, and we have to say, okay, if this many people have been vaccinated, and you're truly not seeing the data that supports the severe symptoms, all these things that we're hearing, we have to really take a step back and say, okay, maybe this is just people touting the misinformation, the drama
Mhm.
of it, the theatrics of it. Because much like rumors, as we all know, that information is more salacious and it spreads far faster than the truth would.
Mhm.
And that's one of the things I think as healthcare providers and professionals, we're going to learn from this. We're going to learn how to dispel misinformation and how to
Mhm.
purport positive information and the truth a little better. I think if anything we could have improved on, we could have improved on ways to provide accurate communication to the communities on a larger scale. Granted, our interest and our focus were more so trying to eradicate this condition, but I think one thing as we look back and gather data, we're going to find better methods for communicating and combating misinformation as time passes. That's one thing I really think we're going to take away from this as providers.
Mhm. Wow. Some good points there. And Rachel has a question. Rachel says that do Delta patients get sicker quicker, and are they tending to need hospital younger than the first wave of 2020 COVID patients, where many elderly and frail were hit very hard? So, what are some of the biggest
Absolutely.
differences you've seen really with the Delta variant?
The one biggest difference and the scariest is comorbidities is out the window. We heard early on, like, hey, if you don't have any comorbidities, diabetic, high blood pressure, heart disease, all those things, then you're fine. You'll be okay. Just wash your hands and wear a mask. The Delta variant, very different. Um, and unfortunately, I do have very tough conversations with people and people who are against the vaccine or who think this is still a hoax. I say, I have put entirely too many 18, 20-year-olds, 35-year-olds in body bags. It gets
Mm.
old after a while. When
Wow.
I'm looking at a young girl who looks like me, I'm 36 years old, about to be 37, and I'm assisting her family with saying her goodbyes. It's unfair. You can't justify it. It makes no sense. It's beyond logic and reason. We have to get to a place where we really stop listening to the noise. We stop listening to things that don't make sense, and we start listening to the healthcare providers and the data.
Mhm.
Delta variant has made it very difficult to even rationalize how difficult and how big COVID had gotten. Um, I got very tired of having to be the last person to hold someone's hand because,
Mm.
you know, their wife is saying
Mhm.
goodbye on FaceTime.
Wow.
Um, I'm holding that man's hand. They've been married for 40, 50 years. And she's too scared to come in and say goodbye because she has cancer. She's immunocompromised. And so I have these conversations with these families, and I say, no matter what, your loved one will not die alone. That is
Mhm.
always my personal promise to every single family member. If I'm
Mm.
caring for them and they're at the end of life, they will never die alone. But it gets up to a point where you say, enough is enough. You can't
Mhm.
rationalize putting a 22-year-old black kid in a body bag. When I was talking to him just 24 hours, and he said he was saying, begging, please don't let me die.
Wow.
Um, you get to a place where you say to your people, your community, your loved ones, we have to silence the noise and listen to the data. We have to take this seriously. We have to get
Mhm.
vaccinated because just even recently, a community here in Florida put out a notification that the cemetery, the local cemetery that a lot of African Americans are buried in is full. We
Mm.
just had to bring in fairly recently a refrigerated morgue truck because our morgue was overran with bodies, and the funeral homes were just, they're overwhelmed. We have to really take responsibility for the health of ourselves, our loved
Mhm.
ones, and our community. And we have to take this very seriously. Luckily, I think people are getting the message. We're getting the
Right.
message slowly but surely. But
Mm.
unfortunately, it wasn't without this catastrophic loss of life. And that's one of the most devastating things about this variant that I've seen.
Mhm. Wow.
And
We have a few
Danielle,
questions. Sorry, Kev.
mhm.
Carol and Anne, based on what you just said regarding the or your body's response
Mm-hmm.
to the vaccine, they're saying that if they didn't have a response at all, like they didn't have a fever, they didn't have anything, should they be concerned that maybe
That's a good
they're not
question.
getting as much protection from the vaccine?
That is a very good question. No, no. Your body is going to do that, and that's the beautiful thing about the way we were created. Once you get the vaccine, that messenger RNA is going to do exactly what it needs to do. So, in the event that you were to come across that vaccine or that bug or COVID again, your body immune system is going to kick in immediately. You didn't have to have this severe immune response in order for that process to happen. And that's just not with the COVID vaccine; it's with any vaccine. So, for example, I get the flu vaccine every year. I've never had an immune response. My husband sometimes will get some sniffles and things like that. So it varies person to person. But that's a very good question. But
Mhm.
no, you are still fully protected.
Mhm. Kevin?
Yeah, no, I was saying, Danielle, I know, you and I talk all the time about some of your observations as you see patients going in, and I know Asia kind of mentioned some of that. You want to kind of touch on some of the stories that you shared with me?
I would definitely say Asia's sentiments hits it on the head. I take my hat off to our nurses all the time. The respiratory therapist, the question that someone asked earlier, of
Mm-hmm.
how much people are really involved in the team.
Oh,
She didn't
good
even
point.
touch
Good point.
upon if they got to get prone, turning them prone and supine.
Mm.
I tell them it just really blows your mind. The physical therapist, just everyone else. And I definitely felt your passion, and I felt the heartbreak because that's what I hear from my coworkers. And it's sad that they feel so numb at a point where you almost slightly get desensitized, and it's not fair. It's not fair that you keep dealing with this. And something that I think about being in the States and knowing the resources we have, I think of my family. I have family from the Bahamas and Belize, and I know that we don't have the same resources back home that
Mhm.
we have in the States. And that's just something that I definitely tell the people in the Cayman Islands to think about. That, like Asia said, she
Mhm.
traveled across the country. There were resources that they could pay these nurses to go places, but who's going to come in? Who's going to come in and save the Caymans if it gets to that point? And you
Yeah.
don't want it. You
Right.
don't want it.
Yeah, it
Wow,
just goes
that's
to
a very good
show that
point.
it's so important to ensure that the medical system is it has that antibody treatment, the remdesivir and other things on standby for when we ultimately get those cases, and as well as our EMS side of the house. That's Jen and Cosette, on that side of it. How do you think, Jen? I'll share with I guess our viewers what you feel EMS need to start doing in order to ensure that they are ready for when you have breakthrough cases and other COVID people calling you for or calling 911 for help.
I'd make sure they have enough PPE, for sure. And it hasn't really presented like any sort of respiratory illnesses that we're normally trained on. I found that most patients don't have any wheezing, they don't have any rales, they don't have any, their lung sounds are clear. Just a couple weeks ago, I had a 30-year-old that was satting at 40% on room air, and she was talking to me.
Mm-hmm.
A little short of breath, a lot of short of breath, but she was still awake and she was talking to me, which is completely unheard of. As soon as she would start talking to me, she would like sat down to like the 17%, I think was the lowest that I saw her at. And generally in protocols, we want to intubate these patients right away. Satting at 40%, you have to intubate. But I've found that with patients that I've followed up with in the hospital, the ones that get intubated generally don't do as well. I think that would be right, Asia. Is that correct?
Absolutely.
So,
Absolutely.
So my goal now with COVID patients is that I just want to pump them full of oxygen as much as I can for as long as I can to get them to the hospital. Now, if they start to get what we call nodding out, they get tired, then yes, of course, I'd have to take over their airway. But just doing high flow O2, like I had a non-rebreather, which is a mask with a bag on the patient at 25 liters, which is a lot more than what we're trained to do. And then 6 liters nasal cannula underneath that. So I was giving them as much oxygen as I could to get her to the hospital. And that was on that 30-year-old that was satting at 40%. I got her up to 82% with that. And that was the highest I could get her to. And the hospital, they're on an oxymizer, which is like a nasal cannula with like a mustache. And they kept her in like 89, 90% with that. So.
Yeah, and one of the things I had mentioned on the morning show that's is on Cayman Mall Road is one of the things I'm telling people to do is invest in a pulse oximeter. Mm-hmm. Everyone should have that with them. For me personally, I have one in my backpack, I have one in my office, and I got a couple at home. I always walk with that because that's just one of the things that's important. To some of those numbers, Jen, that you were talking about, that's what you need to know what your numbers are. So you want to kind of share, any one of you really, what your numbers should kind of be at when you really need to be concerned.
Well, I know that normal is 94 to 100%. Anything lower than that is typically normal as far as I know from COVID. But I would say that when you start getting into like 85 and below, just resting, meaning like not doing any activity, and you're COVID positive, I would say would be a cause for maybe some concern. I don't know if Cosette or anybody else has any input on that. As far as I don't really deal with like a lot of like that at home stuff. I just get them when they're like super, super sick. So Cosette, Asia, do you have anything to add to that?
I definitely agree. And this is a thing, especially for someone who's young and doesn't have any comorbidities or does not have COPD or chronic obstructive pulmonary disease or asthma. Your body is in good shape. So your body has compensatory mechanisms that will kick in the event that you're not oxygenating well. So you could be feeling okay because your body has that backup system that will kick in to kind of boost up your oxygenation in various ways. That's another TED Talk. But that's how you could be walking around and not be oxygenating optimally, but still be kind of going about life. So the idea of having a pulse oximetry is not a bad one, because you could be feeling well, but could be hanging around 85 on the pulse oximetry. Anytime you're short of breath, if you feel like you're walking a very small distance and you're like, geez, that took the wind out of me, or you're noticing that your daily activities are taking you a little longer and you're noticing your breathing's a little labored, those are some things that should clue you in that, okay, there may be something kind of going on.
Mm-hmm. We've got a question from YouTube viewer Charlene, and big shout out. We've got over 135 people between Facebook and YouTube. Charlene says, what's the long-term illness in children and the elderly if unvaccinated and becomes infected? So when we talk about long haul COVID in particular, what are you guys seeing?
Yep.
So, oh, go ahead.
Oh, no, and I was just going to just mention real quickly that we do have a show that is going to be focused with a pediatrician to answer a lot of those children questions. Because again, Asia and the others on the panel, they all are more in the hospital right now, not long COVID. So they're right now COVID type discussions. So those questions will definitely be answered by the real experts, the pediatricians.
Right.
But you know, those children who might be presently hospital, Asia, you might be able to answer some of that.
Yeah, I will say this. I don't work pediatrics, but we do have long COVID patients who are coming in with the long-term effects and complications of what we're calling long COVID. And so what COVID tends to do is it remodels the lung tissue and it becomes what's called fibrotic, meaning the lung tissue loses its ability to expand. It loses its elasticity and it becomes more solid. And why that's an issue is because if your lungs aren't as elastic as they should be, you're unable to move oxygen and waste or CO2 out of your lungs for proper ventilation. And so that's what those long-term COVID patients are dealing with. People are making it through the acute phase of COVID and then going into long COVID and then passing later because of having fibrotic lungs. Unfortunately, as well, COVID has the ability to cause what's called hypercoagulability. So you are seeing people who are making it through the respiratory issues of COVID, but they're having strokes, heart attacks. So that's why when patients come in with COVID, we're giving them high dose Lovenox or blood thinner injections. We're putting them on different methods to make sure that their body does not form clots. That does cause respiratory compromise, heart or brain compromise, because that can indeed happen. So a lot of people only associate COVID with, oh, I'm going to get sick, or I'm going to need more oxygen, or I'm going to maybe be on a breathing machine. There is a possibility that you could end up having a stroke as a result of the hypercoagulability effects of COVID. And that's what's scary. A lot of people initially, we couldn't put our finger on why people were going to acute kidney failure or having these heart conditions. But later on, we saw that these people were having massive amounts of like microclots in one person. We just didn't understand why this patient's brain showered with blood clots. The data started to show, and the more we were able to develop trends, the blood thinner injection became mainstay treatment with COVID as well. Much as the more we learn things and we gather data, we start developing the treatment regimen that is tried and true with really good outcomes. And blood thinners is a part of that to prevent those clots. So
Wow.
long COVID is just as dangerous and debilitating as the acute phases of COVID as well. And those people are being hospitalized.
Right. I see someone in the studio called Real Times. I didn't know if they were trying to watch or actually trying to join in, but I do see that they've sent a question here that's a little bit puzzling. So in the back chat, they said, as you mentioned earlier, that vaccines have been around a long time. And in most cases, the vaccine is given once. Why is it that this vaccine has to offer boosters? Or why is it that other vaccines don't offer boosters, for example, like AIDS? Well, there is no AIDS vaccine, first of all.
Correct.
And
Correct.
secondly, there are tons of vaccines that you have to get
Absolutely.
boosters for. So that's total misinformation.
It is misinformation. So whether we're talking about hepatitis, or we're talking about the Tdap, or we're talking about the flu that we do annually, we could go on and on. And it's just, a booster simply is, we're not 100% sure the lasting effects of the vaccine or that immune protection. So there's no harm in thinking or saying that, okay, well, we need a booster. And that's also a lot of us, and Cosette can probably mention this, when we start healthcare programs, we all have to get lab drawn, and we get titers. And titers, they kind of tells you where your immune system is at being immune to certain conditions. And if your immune system is not showing that you're at a certain level, you just need a booster. It's just like any other thing, sometimes you need a little upkeep, you need a little maintenance. And that's how I look at boosters. There is no AIDS vaccine, as you addressed. That is misinformation. And there are, as we said, many other vaccines that do require boosters.
Yes.
So
and let's just go through for the benefit of real time, so that they can again walk away from this program hopefully having learned something, let's list out some of the vaccine boosters that children need: hepatitis A, B, Haemophilus influenza type B, measles, mumps, rubella, so the MMR vaccine, tetanus, diphtheria, and pertussis. I hope I pronounced that one right.
Pertussis, pertussis.
Varicella.
I got my pertussis when I had a baby, and I was in my 20s.
And booster shots for that, for varicella. And the ones that you might need as a teen or adult include the Tdap, which is the how do you pronounce it? Pertussis.
Pertussis.
Yes. Shingles, pneumonia, varicella, and the MMR. So that's just to list some. So real time. Please go away knowing that there are a lot of vaccines that require boosters, not just COVID. And I think the important thing to recognize here, folks, is that the coronavirus is so incredibly new that the human race has not had, this particular version of it, COVID-19, the human race has not had an opportunity to really build up much of a natural immunity towards this virus. So even though some people have an idea in their heads that let's all just catch it and have a COVID party, and eventually, we will have this herd immunity happening, the risk that is involved in doing that is sufficiently, it's too much of a high risk for people to want to risk their lives. Would you agree with that?
Absolutely agree. And when people talk about herd immunity, and I said, what you're not going to build is herd immunity. You're going to build herd funerals.
Sorry, say
That's
that
what
again.
happens. I mentioned to people that you're not going to build herd immunity. You're going to have herd funerals.
Oh, wow. Yeah.
And that's how we need to look at it, because we're not, it's being irresponsible to think that A, that's going to happen. And B, even if these people don't have this severe symptomatic COVID from these COVID parties, what about their grandmother that they're going to visit in 2 weeks? What about their mom who has lupus and who already has no weakened immune system? What about the lady at the grocery store that they're going to come in contact with who helps take care of her mother? What about everybody else that you're going to come in contact with? Unfortunately, we tend to have this ethno or egocentristic view of the world, and we tend to think about ourselves. We don't think about our neighbor. We don't think about our neighbor's loved one. And I think if we kind of thought about that and thought about each other a little more, I may not wear a mask, even if I may not come in contact, or even if I didn't believe in a mask. How about we do it because we care about our loved ones? How about we care enough to stop the spread amongst our community? And I think the more we start thinking about each other and those we care for, we can really start making some better decisions.
Yeah. And that's where not really bringing or trying to bring politics into it, but it's one of the difficulties with the politicians when they're making these decisions, and then they're thinking, okay, well, how can we've said it until our face is completely blue or purple. Wear your mask, do the things to protect one another. But if too many people are not following those guidelines, okay, what else can we do? Do we have to mandate it? No one wants to mandate anything. We just want people to do the right thing.
Good evening, Paul, who's joining us in the Bahamas. Going back to Charlene's question, I do have a video here that talks about some of the things that you should really look out for as it relates to COVID in children. Because, of course, here in the Cayman Islands, for example, we're particularly concerned about, the health of our children. So we're going to be publishing a number of stories a bit later on, just some healthy tips for dealing with the coronavirus in children. So how to tell, for example, if a cough could potentially be a sign of the coronavirus.
Just a minute, Pumpkin.
All right, folks. So hopefully that is some useful information to Charlene and others. Melita was asking a question earlier, trying to determine if she may have had COVID at some point in 2020, or 2021. She said she had internal fever with no other symptoms a few times, but no longer is presenting those. So, I mean, if she wants to confirm for sure if she's had COVID-19 or the coronavirus, she could do an antibody test, an antigen test, and that would certainly tell her with a degree, 100% certainty, if she's ever been exposed to the virus.
Absolutely.
Yeah, that would be an antibody test.
Yeah.
Yep.
Juanita says, how safe is the vaccine for pregnant women? So we know that the FDA and others have actually recommended the vaccine for pregnant women. Have you guys in your line of work as frontline workers come across any pregnant women who've been vaccinated, or perhaps some who haven't been vaccinated?
Yes. I've had my share of women who are not vaccinated. And even most recently, last week, a woman ended up so respiratorily compromised that the decision was made by her clinician. She was 26 weeks pregnant. They decided to go ahead and perform a C-section in order to save the baby as best they could, because at that point we then had to put her on a ventilator prone and paralyze her. And what that means is a patient who is severely ill, especially in ICU, we put them on the ventilator and then we lay them on their belly. So they're kind of just on their stomach. But what we have to do is chemically paralyze them. And we do that so that we can have full ability to allow the ventilator to take over all respiratory support. When you're in that state, it is one of the worst states of ARDS, or acute respiratory distress syndrome, that you could possibly be in. Unfortunately, that woman did pass away. Wow. She did pass away. And last I heard, her baby was out, still in the NICU. And now the father is dealing with a newborn in the NICU, and his wife, who did pass away, which is the worst case scenario. But the data is really coming out to support getting vaccinated while you're pregnant. And we're starting to see those antibodies show up in breast milk, which is really exciting news. There's going to be more data on that as the time comes. I actually just read that I read that this week. So I'm super excited about that. So it's important. It's important, just like any other population, that our pregnant women get vaccinated as well, not only to protect themselves, but their children, their unborn children as well.
Right. Wow. Great question. Anybody else? Jen, did you want to respond to that at all, or?
No, Asia.
That sums it up.
So.
Yeah. Danielle, anything from a nutritional perspective that you wanted to speak to as it relates to, pregnant women getting that little extra protection, especially whilst they're pregnant,
Not so much during pregnancy, but definitely the vaccine. I'm a certified lactation counselor, and I would say that, yes, it does. Those protections pass through the breast milk, and it's definitely an added benefit for the mommy and the baby in the long term. But just how someone was asking the long-term symptoms, COVID from a nutrition standpoint can be devastating, just with how it deconditions your body. You just get so weak, you just really don't have the energy that nutrition-wise, it does have a long-term effect with all the weight loss and everything else.
So Danielle, you want to just kind of go in and why nutrition is so important with someone with COVID, or even before they get COVID as well?
I think it's nutrition. I think of it as a fuel for the body, that it's just really important to just try to give your body the best chances possible to make sure your immune system's as healthy as possible. I think people try to hold on to their hope that if I take these mega doses of vitamins, it'll really get me to that point. And they might try to rely on that natural side of things versus the vaccine. And sadly, there's no data that shows that mega dosing is really going to help them. So the vaccine, on top of just building a natural immunity, is really what's going to be helpful. I had a patient that the stuff that holds on to you in her final days, not knowing it was her final days, was asking for an anti-inflammatory diet, because she thought, or she read someplace that if I could take a diet to help me fight this inflammation, that's going to be my saving grace. And the nurse, right before she passed, one of the last things she said to the nurse was, please hold on to my grapes. Don't let them take my grapes. And the nurse said she came out of the room and she's standing there with the grapes like, what do I do with this? And it's things like that stick with you. So I think for all the frontline workers, it's those little personal stories that really hurt. And as much as I want to say as a dietitian that we can eat our way out of this, we just really can't. It takes a lot of faucets.
Well, as we start to wrap up the show, I can't believe it's been over an hour already. Thank you, ladies, so much. And I must say, I'm especially pleased to see that this has been a panel of professional women tonight. Hats off to all of you. Keep doing the wonderful job that you're doing on the front line, because I cannot imagine how difficult your jobs must be. I mean, I shed tears, and I'm nowhere near the front line when I see some of the horrible stories of people just dying, and what I think is a senseless death, especially now that we have a vaccine and we have a fighting chance at trying to get COVID under control. Just any final words from each one of you as our listeners are listening to this program. I've got a lot of people messaging me saying that, this is a very interesting show and they've learned a lot today. What would you say to people who are watching? What's your best advice that you could give them?
Get vaccinated.
Yeah.
Yeah.
I would say, if, when we go on a jet ski in the sea, we put on a life jacket, even though we can swim, right? Why do we do that? For added protection. The vaccine, that protection. So get the vaccine.
Absolutely. I would have to agree. Get vaccinated. Wash your hands. Be mindful. Look at this. Always mind your sources. Always mind your sources. If something just seems off, or it seems just doesn't make sense, there's a good chance that it just truly does not make sense. Connect yourself to resources like your local health department, and your primary healthcare physician. Have those conversations with them. Have those conversations about COVID and any other things, with them. Not your Facebook friends, or as much as we may love our aunts and everybody else, we have to be mindful that we're having those conversations with the right people and get vaccinated.
Yes. And even when you listen to some physicians, because we have some here that are, believe it or not, telling people all the wrong information.
Well, that's unfortunate.
Yeah, it really, really is, Asia. But it also, this whole anti-vaccination movement and misinformation, it shows you that it really has nothing to do with someone's sometimes professional or even intellectual capacity. There are other things that are driving their belief in these conspiracy theories and their disbelief in vaccines that have proven over many years and decades now to save millions of lives. And I think that we have to accept that the research and the science says that the coronavirus vaccines, the COVID vaccines, are not going to be any different than that. We just have to let them work, and the best way that they can work is for as many people to become inoculated as possible. So thank you, ladies. Kevin, hats off to you. Kevin has been putting this series together for us here in the Cayman Islands. It's the CMR COVID Spotlight series every Tuesday and Thursday for the foreseeable future. Tonight was all about frontline workers. We've got some real insight from these ladies on how they're handling different aspects of being on the front line. And again, ladies, thank you so much. I hope one day you can come and visit us here in the Cayman Islands once we reopen. Jen, you can come back home.
For Jen to come home.
I know, Jen, come home. We'll all, do a nice meal out somewhere. And thank you so much. I know that our audience really appreciated all of the information tonight. Kevin, give us an idea of what's coming up for Thursday, please.
For Thursday night, 7:00 Cayman time, we're going to be reaching out or speaking to a dean of the pharmacy program at the University of South Florida. As well, we're going to have some of those who are involved with clinical research, ongoing clinical research for things related to COVID, and those who were involved with some of the vaccine trials. They will be on the show to kind of talk to you about the process and some of the things that go on before it's allowed to be given out to the public. So you don't want to miss that show again on Thursday night. And then next week, we do have a lot of other exciting things coming up. So keep your eye out on the Cayman Mall Road Facebook page for when we have different updates on what the upcoming shows will be. And of course, we'll see you again tomorrow morning for the regular show, and then Thursday night.
All right, Kevin, thank you so much. So yes, in the morning, we'll be back at 7:30 for another edition of the Cold Hard Truth. Tomorrow is Wednesday and it's Impact Wednesday. So we've got none other than a member of the PAC government, Ms. Kathy Wilkes, joining us. She's been really, really busy in her constituency and she's going to be sharing a lot of what she's been up to with all of her viewers. So folks, thank you so much for tuning in this evening. Rachel, thank you as always. She said really powerful information. Thanks, Kevin, and all these amazing dedicated professionals for their expertise and care. As Sonia says, great information. Thank you, Sandy and Kevin. Juanita enjoyed it as well as Melita. Eli says, thanks for the information. Good evening, James. She says, great job. Thank you all so much. Claudia has given her vote of thanks as well as Alice. Loretta, Anton. Hey, Anton, how you doing? Great job, ladies, Anton says. Loretta enjoyed it. Miss Ann said, an amazing informative show. Sandra, thanks so much. Maria, who is a nursing professional, says she's a nurse, said, excellent program. Katie O'Neill, thank you so much, Katie, for joining us. Dee loved Asia. She says, great job, Asia. Shelda also said it was a very interesting discussion. So Donovan and the rest of you, thank you so much. Share the link, folks. This is the type of information that we need people in our community to, be getting correct, accurate, talk to frontline workers. We've not really had the benefit here in this jurisdiction of having access to frontline workers here yet, which I guess is a good thing. Eventually we may get there, but these are experienced frontline workers who really know the real score, folks. Let's learn from them and their breadth of experience. Kevin, big shout out to you, my friend. Thank you so much for putting the CMR COVID Spotlight series together. And Kevin's got he's pulling all kind of tricks out of his hat, folks. He's got people lined up, virologists and others who are going to be coming in the program. So I'm super excited to be here in the background, just hosting it every single session. So we'll see you guys in the morning and have a good evening.
Good night, everyone.